Hello, everybody. My name is Joel Filderman, and welcome to the Dog Trainers Connection. I'm not a dog trainer, but the people you see here are. And together they have a number of years of experience in the dog training world. And we get together to discuss a topic, usually. Today, we're going to do it a little differently, though. We weren't able to really come up with a topic today. And David was about to ask a question to the group that he's been getting some calls based upon that. I said, you know what, let's stop it and let's try something different. And let's see where this goes. So, David, what were you going to say?
Yeah, Joel, thanks. What I was going to mention is just the fact that I'm getting some calls from clients inquiring as to whether or not, having whether it be neutering or spaying, how that affects the behavior. This one, for instance, this one woman called me up, left me a message and said that her dog was perfectly house trained, got recently spayed, and now the dog is marking pretty much all over the house. And I've had things like that before. And so I guess it's that question plus another question that's a little bit different, but somewhat on the same topic, is just like I know UC Davis in Berkeley, I believe, did some study not too long ago where they found sometimes getting spayed or neutered was not so good. Usually it's recommended, as we all know, around 6 months as a general rule of thumb. But they were finding the cancer rates were going up higher. So then it becomes a question of, okay, well, maybe we delay it there, but then you have the problem is, would I have some behavioral issues? Then you have to address that. So to find that balance. So I guess I'd like to throw it out to the panel and see what their thoughts are on that.
Well, Steve, I know you have a lot of thoughts on spaying neutering, so why don't we start with you today?
How much time do you have? So, I've been on this one for a long time, Dave.
Yeah.
You know, like years. So, when I had my training facility, when I closed it, I actually learned by counting the files, more or less, that we were looking at like 2,000 to 3,000 puppies a year in group classes, because we were doing numerous classes just about every day.
Mm-hmm.
So anecdotally, way back then, I noticed that a lot of these puppies that were coming out of shelter systems and sterilized as pediatrics didn't get along very well in the group environment, which that's not exactly what anybody ever talks about. You know, they usually like, well, no, it doesn't affect their behavior in any way. But when they started to actually research this thing, which if you ask me, pretty much started big time with the University of California at Davis, the vet school. So they did the golden retriever study, but this thing started to come around with there was so many, there was studies, there was money to look at the effects. And so James Serpell from University of Pennsylvania, he did a bark park study, published it in the JAWS journal. And at the end of his study, he basically reports there was not one fight incident among intact dogs.
Really?
All fights were recorded were among sterilized dogs. That's
wow.
What when I was a young vet tech, I was trained to say that you do it at 6 months, you avoid cancer, it calms them down, and all of this rhetoric.
Sure.
And now, there are statistics where if you sterilize a dog before it's mature, excitability increases. That's not a terrific trait, excitability. So if you already have a breed that tends to be excitable, why would you then create more excitability? You know, forget breed, just in dogs in general.
Sure.
Who needs that? So if you put together the nonsense about male dogs fighting because they're intact, it basically can be nonsense. Dogs that fight, that's all. It doesn't matter if they're sterilized or not. Prostate cancer is more prevalent in sterilized dogs. So they can't use the line of let's castrate the dog and your dog's less likely to get prostate cancer. Or let's spay your female, she'll calm down, she won't gain weight. There was so much nonsense over so many years that the most recent lectures I've attended, there are veterinary surgeons suggesting that they did a lot of harm to dogs over a lot of years because they didn't know better.
Right.
That 6-month model of sterilization was based on a small study in the early 1960s. It wasn't good then, and it's worse now because we know more now. And so I think that, and there's some like really fascinating stuff. Like I read one that said, they were very specific. So Benjamin Hart says, if you have a golden retriever or a Rottie, if you never have to sterilize it, don't. It'll live longer and healthier. You know, there's all this stuff. But then there was a study that talked about like Labradors. They broke them up. And their Labrador conclusions were, if you have a male Labrador and you want him to be social and friendly, leave him intact. If you have a female Labrador and you want her to be social and friendly, leave her intact. If you go to the Doberman, they say, if you have a male Doberman pinscher and you want him to be social and friendly, you neuter the dog. If you have a female Doberman and you want her to be social and friendly, you leave her intact. And they actually had about 10 or 11 breeds.
So they broke it down by specific breeds.
And the outcomes were different. So that's a fascinating thing, right? I mean, I found that I was like, just.
That is fascinating. And particularly the Doberman, you've got the male and the female, but they're totally opposite. Is there a reason?
Because they're claiming that male Dobermans have a tendency towards, as they get mature, sexually mature, they may show some forms of aggression that can be thwarted off by sterilizing the dog, while the female becomes more aggressive if you take the estrogen from her. So, you know, but yet in the Labrador, both of them would be more social if you left them alone. So I'm sure if I looked at all these, you know, the 11, I could have plucked out one that you better sterilize both genders in order to get social friendly. So I'm taking one behavioral parameter, social friendly, and I'm giving you the outcomes of those that I remember from this study. But there are other parameters like excitability and, you know, things other than aggression. So there's that. And then there's the, years ago, before there was any science, I used to go on the veterinarian's face and say, tell me how doing a procedure like this on all breeds at the same age is good medicine, because they don't mature at the same rate. That was my thought. I got in the face of many veterinarians. I was threatened that I'd never work again if I didn't shut up.
And you were a vet tech.
Yeah, and I was a vet tech. And they liked me, but I was talking to my clients about what I felt was true. And I got threatened. If you keep talking, you won't work again. And I talked anyway, because obviously none of us are really rich, or we probably wouldn't be sitting here right now. So we do this because we give a crap about what we do, how we do it, what the outcomes is. We want positive outcomes. And that was my shtick. It was all about that. And they didn't like it because they were saying one thing and I was saying something else. So the client makes the final decision. At the end, they have to live with the decision they made. And if I go into a case and the dog's already sterilized and it's excitable and it's urinary incontinent or whatever the negative outcomes of that sterilization were, it's too late. What am I going to say? Am I going to beat them up over it? You know, it's done. Can't put the stuff back, right? So it does put me in a spot, I feel, when I go to somebody's home and they have a dog that's sterilized, and I feel like the problems I'm looking at are associated with the sterilization. You can't put it back. So in a case like Dave's, where it's like the dog was okay, now it's sterilized, now it's not okay. I think, I don't know, personally, my take is you got to go to the individual, whatever if they're elimination behaviors, you start treating it like a puppy, right? Backward. I mean,
go back to basic house training.
Yeah. Helen, what do you're nodding your head. So.
Oh, but I was just agreeing about going back to basics. If you didn't have a potty training issue before and now post sterilization you have to go back as though it's a puppy and retrain. But I would first check out, make sure that they're not a physical problem as a result of the sterilization. Like spayed females, in my experience, tend to be a little more incontinent than intact females. You know, I see it a lot where they're spayed. I mean, it usually happens later on, that they start getting a little incontinent, and they also seem to get UTIs all the time. I have it with my 2 females. They both keep getting UTIs. They're spayed females, and they keep getting UTIs, and one that's older is starting to have a little incontinence. That's not a training issue. That's
interesting you're saying that. I had someone else like that, Helen. Yeah, that makes a lot of sense.
Physical problem.
Mm-hmm.
My boy got a tumor on his tail, and ultimately the tail had to be amputated. And only after that do I do some research, and I find that this particular, I forgot the name of it. It's like unpronounceable to me. And of course, this is like 10 years ago. When I did a little research on it, this particular cancerous tumor is exactly where it occurred, near the very base of the tail, is very common after neutering males.
Neutering males. Mm-hmm.
So had I known that, I probably wouldn't have done it, but we all buy into the, we used to buy into the what I call propaganda about spaying and neutering, that it calms them down, it stops certain cancers. It's just, I don't believe any of it anymore. If you took a human and neutered them before adolescence, they would not be the same person behaviorally as they would if you left them alone. So if my clients ask me, I definitely encourage at least wait until the dog is mature. If you want to spay or neuter, I get that people want to do that, but wait till the dog is mature at least, because hormones do play a part in behavioral development. They do.
So is there a certain year or a certain age at which you consider a dog mature, or is it up to the...
I would say at least 2 years, or, if it's a female, you can go by after they've had a heat. But if you don't have to, if you're a responsible dog owner, it's not that necessary. It's really not. Unless you're running your dog around in dog parks all the time. And even then, if you're, it's only, it's only certain times that females, when they're in heat, can get, can have a litter. So I just don't know that it's as necessary as it used to be. I don't see that it stops behaviors or improves behaviors. And, time after time I get clients who want to neuter a male, particularly because it'll calm him down or it'll stop him from marking in the house. And I'm like, yeah, okay, you can go ahead and neuter him, but don't count on that. Don't count on that happening. If he's going in the house, go back to beginning on potty training. So that's my 2 cents.
Yeah, well, that makes sense too, because actually, now I think about it, I had a client a couple months ago that had her dog spayed, and the vet told them that there was a little bit of tissue left behind inadvertently, and they said to go back in, yeah, they could do that, but it's not worth the risk of possible infection and complications, et cetera, et cetera. So they said if it's not really causing any issues, just leave it. The only issue that would happen, and this is where I kind of came in, was when the dog was in heat, but not really in heat, but had that illusion in being in heat, the dog would get more aroused, excited, and things like that, and get a little aggressive at dog parks and things like that. And I said simply, just in those situations, when you know she's going to be in heat or that kind of situation, don't do it. Manage the situation, because in other contexts, the dog is perfectly fine. So whether that's the right answer, I don't know, but that's my feeling on it. I don't know if anyone else had any other thoughts on that, but something like that.
Yeah.
So is there anybody here who is in favor of the spaying and neutering, or isn't? And okay, so Steve, you are. That's interesting. I didn't think you would be.
Well, because I'm in favor of, I find that females that stay intact run a big risk of getting a PIO at some point. And the uterus gets infected, and it's an emergency procedure. You got to get it out. At some point, it's a good idea to get the uterus out. If they're not using it, then they can lose it. They don't really need it. If you're not going to breed them, then, but not when they're puppies. Not when they're puppies. Let them grow up. Let them grow up. And interesting, Helena, I had a talk with Dr. Dodman, with Nick Dodman once.
Yep.
Because before all the science came out. And I said to him, Dr. Dodman, I could use your help with something. And he said, what's that? And I said, that's with popularizing the idea that spayed females oftentimes will become incontinent. And he said, well, that's not necessarily true. And I said, well, have you ever had a case of incontinence in not a geriatric dog where they don't have hormones anyway, because you could expect that would be where an intact dog would become urinary incontinent if she doesn't have hormones, right? But otherwise, like a healthy middle-aged dog, young or middle-aged dog that's urinary incontinent, intact. And he said, well, no. And I'm like, right, no. I mean, I've been around a lot of years. I haven't found one. I mean, if you have an incontinent adult dog that's not geriatric, then there's something wrong with that dog that's out of the ordinary. And he said, I can't talk about that. And I said, why not? And he said, because we need studies. He refused to go with the anecdotal thing. He wanted, like, give me the research and there's something we'll talk about. I understand where he's coming from. He can't sprue off, I mean, he's a little too popular and important, I guess, to just like lay it out like that. But I was on him like white on rice. It's like, no, come on.
Steve, I wanted to comment and ask you about when you said females a certain age not using the uterus, may not need it. I think that's also, just playing devil's advocate, a mindset too, because doctors do that with people. They go, oh, you don't need that part. You don't need that ovary. You don't need, you're past menopause. You don't need that. Instead of them, say if a woman has a fibroid, instead of just addressing getting the fibroid out, it's like, you don't need that. But the thing is that I think that we need to try to keep all of our parts because they function together. You never know in the future what, that uterus might help you out with or whatever. It's just muscle tone. I don't know all the ramifications that could happen, but I don't necessarily, I know vets focus on pyometra, but I would have to know the statistics about that. Is that just a worry or, how often does it happen? What are the other components? Is the dog getting a healthy diet? Is the dog, is there something genetically weak about the dog? I would have to know more, but I know pyometra is bad because it can be hidden and you don't know it. But how many incidents of it statistically if you didn't spay the female? So I'm kind of playing devil's advocate with that because
I got you. The thing is that as the dog gets older, the surgical risk gets like more severe. Right. So if you have an emergency pyo, and you have to anesthetize like a 10-year-old dog to do the surgery, you got to hope that the kidneys and the liver are in the kind of shape to deal with the anesthetic, the stress of the surgery, all that stuff. So in some ways, you do it. What does it
preventatively?
In a way, I mean, because you're right. I mean, look, having hormones definitely helps muscle tone, keeps you thinner, all that stuff. But you start to get into that a little bit older, if you're already in great shape and they do the procedure at that point, I think that you're basically, from my perspective, you're just removing that risk of having to have a really like intensive surgery. And if it's one of these closed piles where the dog is not actually
Closed, that's what I meant. Yeah,
yeah,
not hidden.
closed pile is
Yeah.
now the dog is septic because there's no release of the pus. So the dogs that are draining pus, you say, oh boy, and you get run into the vet, and they're usually not as sick as the closed pile, which is getting sicker by the moment because it's it's septic. So that's where. So I could raise my hand and say, yeah, I would definitely say sterilization could be a good, healthy thing at a certain point in their life, just to prevent certain stuff. I'm not worried about cancer. I'm worried about pile. I mean, that's my big concern. So, for whatever that's worth.
Jeff, I know you tend to be a little more holistic than a lot, and so I'm curious, do you more agree with Bonnie, or do you agree with Steve, or is there somewhere in the middle?
So this is one of those topics that all of my hats come into play regarding my opinion. Obviously, I've been in rescue for 17 years. So based on reproductive risks in stupid ass households, I'm a proponent of spaying and neutering.
Right.
Okay. It was an accident. Okay.
Right.
Look, people, it's not an accident. Okay. So from a rescue standpoint and from an overpopulation standpoint, the first words out of my mouth are always spay and neuter, regardless of my training, my dog training hat, and being a holistic pet care practitioner.
Right.
And it's not that those are less than my rescue hat.
But that's what supersedes.
It takes precedence in my mind. So, and again, it's just strictly from a rescue standpoint. Now, obviously, and there's a lot to this, and I agree with Steve. Pediatric spaying, and again, you're going to hear such conflicting things coming out of my mouth right now. For all my rescue friends that are watching, just so you know, spay and neuter, blah blah blah. Okay. Okay, you got it. So
we'll put a crawl across the bottom of you.
No
spay neuter. Okay, I said it enough times. So, pediatric spay and neutering it's big business. Okay. And from a behavior standpoint, Steve touched on it, and maybe a couple other people, as far as development hormonally. Steve also touched on spaying a geriatric incontinent dog on the back end of their life because of their liver and kidney and the shape of their organs. Can they handle it? That holds true for pediatrics as well. So you have an over-vaccinated puppy in all likelihood getting dumped with anesthetic, right? And then getting castrated. Like that's a lot for a 4-month-old or 5-month-old animal to endure. And I'd be hard pressed to assume that there are no consequences to that, right? So, again, from the rescue standpoint, I get it. We just can't adopt out intact animals. We just can't. I have, when they were little puppies years ago, usually the people I knew, because I knew that they were going to neuter the animal, because I wasn't comfortable. And I'm still not. I mean, I don't do puppies anyway. We usually rescue young adults or adult dogs. I don't think I could put an 8-week-old puppy in the vet's office to get neutered or spayed. I just don't think I could do it, regardless of my rescue opinion. I don't think humanely I could do that to an animal, knowing that I was responsible for doing that to an animal. And this is where the whole conflict goes within these, because you spay neuter, but I can't do that to an animal.
Right.
Okay. I got people yelling at me because I use a star mark collar or a limited slip collar, and yet they're exposing these animals to harmful chemicals when they're weeks old. I don't know. It's hard for me to wrap around that. So from a health standpoint, so we have the reproductive risk. In my opinion, there's only one reason to spay or neuter, aside from medical reasons, right? There's medical reasons for everything, whether it's, behavior or whatever. So aside from medical reasons, the only reason to spay and neuter is to stop reproduction. That's my opinion. There is no other valid reason to spay and neuter other than to control the population, right? And now, okay, I'll bring up the cancer thing, okay? It's all bullshit, okay? and I've been looking, and I still look, and I don't go on the internet as much as I used to. There is not a single study on spaying, neutering, and cancer that has a non-vaccinated population and a vaccinated population. So until they come up with the study about cancer and us pumping a whole sorts of shit into our animals and then blaming it because they're not spayed and neutered, then get back to me. Anyone who's watching, if you happen to know of a study, please share it with us because I can't friggin' find one. Okay?
Love to hear it if there is one. Definitely.
I mean, I think it would be wonderful because anytime you talk about cancer, spaying, and neutering, it's always the same line. It's the same rhetoric. It's the same propaganda. Never have I seen a non-vaccinated population versus a vaccinated population with spaying and neutering.
Good point.
Very good point. Very good.
If you're talking about any cancer study with animals, if vaccines are not a part of it, okay, I don't want to hear it. Okay.
So Jeff, so what you're
Speak your mind, Jeff.
So Jeff, what you're saying is that you think it's more likely the vaccinations that play a role in cancers, or the combination of a vaccination and a spay neuter?
Well, that's the thing. I don't know because there's no study out there.
Yeah.
But these people are going around telling me that this is the science. No, it's not. It's the study that I did a study many years ago on wolves in captivity, okay? And my study proved that wolves live longer in captivity, non-vaccinated on a raw diet. That was what my study proved. And all I did was call a bunch of sanctuaries across the country. So basically, a study can prove whatever shit you want to feed to people.
Of course.
So the thing is when it comes to this kind of stuff, especially cancer, we have to consider variables that contribute, known variables that contribute to disease, right? If they're not part of the study, what the hell is the study, right? Behaviorally, sorry, I'm getting all fired up. You know how I get, guys.
There goes the steam.
No idea.
From a behavioral standpoint, obviously we could talk about that forever. I could tell you this. Obviously, I'm in rescue, and I've been in rescue a long time. I've been training a lot longer. People don't come to us. They don't come to dog trainers and say, hey, you know what? My dog, you wouldn't believe it. He's fully obedience trained. He's wonderful around the house. He loves people and dogs. I'd like to hire you. That's not the calls we get. My dog's jumping, humping, aggressive with people. It's leery of strangers. These are the calls we get, right? I don't know the numbers. I don't know. Thousands and thousands, whatever that number is over the years of the dogs I've worked with, right? Almost all of them were spayed or neutered. So I don't know if that gives us any information, but you know, every single animal here right now, they're all crazy and they're all spayed and neutered. Okay. You know, so, you know, behaviorally speaking, from a holistic standpoint, okay, now let me take my rescue hat off.
Which is where we started this supposedly, but we had to go through the other hats first.
Yeah, I told you I'd be all over the place. So whatever. You know, when a human intervenes with nature, we screw it up. Period. It's that simple. So I like what Bonnie had to say. You know, God put shit in here. Don't take it out unless you have to. Right?
Okay.
You know, but I will say behaviorally, one thing about neutered dogs versus intact dogs, they are less likely to flee a yard. That is one thing that I would probably agree with. And I'm not saying immediately post-neuter, but after the hormones subside and go away, you know, an intact dog smelling a bitch and heat a mile away is probably going to get out of that yard if it really, really wants to. You know, and again, that's just, you know, a handful of life experiences. That's all. Then the neutering for reducing energy. Okay. Where did they come up with this stuff? I mean, really? I think they just put shit in a hat and pick it out and say, hey, let's tell them this. Okay. All right. I'll humor people and I'll say, okay, let's assume that neutering does take the edge off, okay? So let's look at, obviously, pit bulls, because I love pit bulls. Pit bulls, right. Boxers, Jack Russells. Let's use those three. Is it fair to say that all three of those are like dogs on crack when they're really amped up, right? Right? High energy breeds, okay? Okay, let's say we neuter those 3 dogs, okay? This is what I equate it to. Everyone is familiar with the Corvette, right?
Mm-hmm.
A really, really fast car, right? It goes about 220 miles an hour, whatever it is. I don't know.
Sorry.
I don't know anything about cars. It's really fast, right?
It's real fast, yeah.
If you have a 6-speed Corvette, right, and you take away the 6th speed, it's still really friggin' fast. So that's what neutering does for your dog's energy level. And the fat dogs that got fat after they're neutered and spayed, I got news for you. They were probably going to become fat anyway.
They were going to be fat anyway. Yeah.
We're exercising them enough.
Yeah.
All right. I think I'm done.
Okay.
Oh my God.
So, David, we started this with your question.
Hey, boy, it really went full circle and then some.
You think we answered it?
You can always count on me
yeah.
to go in different directions.
Oh, yeah.
Okay.
Oh, my God. But that's the other thing, too, if I'm not mistaken, with that study at UC Davis, what they were doing with Steve, they were doing with golden retrievers, correct?
Yep.
Yeah, and I know from a fact that you know this as well, like I want to say it was like 30 years ago, maybe even longer than that, maybe 40 years ago, the cancer had nothing to do with that. When the cancer rates in that breed in particular was very high, I think there was some breeding practices that were not too up and up, so to speak, and that's what contributed to it, if I'm not mistaken. The dog was getting cancer and had nothing to do with anything like that, with the spaying.
Well, it's the same thing then. I guess if you breed dogs that have some predisposition, if a cancer is heritable, and you're breeding dogs that have that, then you're going to have, it's like hip dysplasia or whatever, right? I mean,
that's what I was, yeah, that too, yeah.
I think that Benjamin Hart claims he picked the golden retriever because in Southern California, he had a large number of golden retriever breeders, rescue. He had a lot of dogs that he could work with. And he basically specifically looked at the sterilization. I mean, Jeff has an amazing point. They should be opening that up, except for that if this was all about sterilization, all the dogs were probably vaccinated similarly, and the sterilized ones got cancer and the intact ones did not. So I think there were valuable results, conclusions from that thing. It's not the end all and the be all, because obviously there are a lot of other things, diet, vaccinations, and so forth, that will contribute to various cancers. But the sterilization specific study was the dogs were probably all vaccinated similarly, and the intact dogs were healthier for a longer period, and the sterilized dogs were prone to cancer. The cancer that the sterilized dogs would get was kind of interesting, because obviously, they always talk about the mammary cancer being a gigantic issue with veterinarians that help push their sterilization recommendations, but they don't talk about osteosarcoma. There's so much hemangio, huge in dogs. So, there are cancers that clearly are more likely to get if you get sterilized than not. And then there are the other ones that they scared us with, that in a percentage wise, that mammary tumors in female dogs are not that big a deal. And if you catch them and you take out the lump, usually it's a done deal. It's not so crazy. So it's complicated.
I was just going to say, then it depends on that study, where do they get the dogs? You know what I mean? So where they got those dogs from? Was it in the genes? Was it in that lineage of that dog or dogs, possibly? Before it got to them to do the study, even though the study was controlled in a good way, they had no control over where they got it from to a certain degree.
Well, I think that if you do a good study, then you're paying attention to the genetics.
I mean, hopefully, yeah, that's true.
And this is a vet school, and this is Benjamin Hart, who's a veterinary behaviorist. I have uber respect for this guy. So I feel like he did a really fine thing. He did a webinar. I remember him saying from his mouth, he chuckled a little bit before he said, "We've done a lot of harm over the years. We've done a lot of harm." And, this is what we did. We thought we were doing the right thing. I mean, they didn't go at it trying to hurt anybody. I think they honestly believed that they were doing the right thing.
They thought that they were saying what was the right thing. Yeah.
Right. They didn't mean to
sure.
Really just kind of push it down the wrong road. I mean, I think they really felt it was the right thing. And it started to get, it's testy now, because there are the old guys who are like, oh, no. I'm sterilizing all my clients' dogs, just like I know a guy who vaccinates every year, despite the fact that he's been told in his face, we don't do that anymore. That is not healthy. You're going to cause a problem. And he said, if I don't vaccinate him every year, I won't see the client because they won't come back unless the dog gets sick. And I want to do well health exams, and it's the vaccine that gets them in the door. Well, they're not going to be well health exams for very long if you keep shooting the dog every year. But this is a mentality of some of these guys. I mean, I don't know what to say. It's frightening.
Well, I don't know how much else we can say. I think, as you said before, Steve, wow, okay. It is complicated, but I hope that the people watching this, whether they be trainers or others, got something out of this, because I think there was a lot of good information that everybody discussed. And it's good to be able to pass that on because that information needs to be out there. So I want to thank everybody for watching this, and want to thank you all for being here. And we'll see you next time. And thanks again. Bye-bye.
Spay neuter.
Bye.
Yeah.
You're not in trouble, Jeff. You're okay.
Oh my God.